Assalamu alaikum and good evening to all of you. It's Ali Khan Wajid, and now you are connected with unique thoughts. And today it's all about Pinktober. Dear audience, dear spectators, it is your second slide. And here you are looking at three women having the logo of Pinktober on their chest. Dear audience, dear spectator, on this slide, you are just looking the logo of Pinktober. Dear audience, dear spectators, it is the month of October, and October is considered the breast cancer awareness month all over the world, and there are a cluster of women wearing pink dresses, even pink hats, and they have adorned pink ribbon on their chest as well. Dear audience, now I talk about what is meant by a Pinktober. The pink ribbon signifies the commitment, dedication, and promise made by a Loman founder. And who was the founder? That was Nancy G. Brinker. And what her commitment and dedication and promise she made, that was just because the death of her sister, and she was Susan G. Komen, and she did all that. What to do? To do all that to eradicate the fatal disease named cancer, especially breast cancer. It is meant to be that her sister named Susan G. Komen, who died just because of breast cancer, and in that certain year, she vowed to herself that she would dedicate her life just to raise the slogan and just to make the people aware that we need to take steps for the eradication of breast cancer. Dear guys, dear fellows, it is the picture of Nancy G. Brinker, whom sister was died just because of breast cancer. Dear guys, dear fellows, once again, there is a slide on your screen, and that is once again the women wearing pink dresses, pink hats, and adorning pink ribbon on their chest in the current month of October, just to create awareness to the people that what they need to do to eradicate this fatal disease of breast cancer. Dear fellows, now I come to the certain point, the history of Pinktober. It was founded in 1985 by the American Cancer Society. Breast Cancer Awareness Month, it is the month of October. Pink color symbolizes as its logo since 1985. The event started as National Breast Cancer Awareness Month in October since 1985. This was a partnership between the American Cancer Society and the pharmaceutical division of Imperial Chemical Industries to fight breast cancer. It is meant to be that there was a partnership between the American Cancer Society and the pharmaceutical division, and the name of that particular pharmaceutical division was Imperial Chemical Industries. Dear guys, dear fellows, today as we are just wearing pink ribbon, but it wasn't started like that. First of all, it was peach ribbon, not pink ribbon. Who was that lady who first of all tried to raise awareness? And that was Charlotte Halley. She was an American lady. Now I talk about some details of Charlotte Halley. Charlotte was the brains behind and founder of the pink ribbon. Her ribbon weren't pink but actually peach in color. Her message of the pink ribbon was spread all through word of mouth and soon became in demand by bigger corporates. Why did she do it? What was there that compelled that certain Charlotte Halley to do all that? Because Charlotte Halley lost her whole family just because of the breast cancer. The members of Halley's family who died of breast cancer, first of all, Halley's grandmother died of it at the age of 45. Then her mother died of cancer in her early 40s. But her sister became breast cancer victim in 1983. Her daughter Nancy, who is now 41, is a 3-year survivor. It is meant to be that it was Charlotte Halley who started the campaign towards awareness in terms of fatal disease of cancer, as she lost her family members of the family, and that were her grandmother and mother, whereas her daughter was also the victim of breast cancer. Dear guys, dear fellows, now one more thing regarding the history of Charlotte Halley. The breast cancer ribbon had been created for the first time by Charlotte Halley, a 68-year Californian resident lady whose members of the family had been died just because of the breast cancer. She took initiative in 1991 to set up a grassroots campaign to urge and stimulate the people to build a national cancer institute and to invest the maximum to uproot the fatal disease called cancer. It is meant to be when she lost the lives of her family, including grandmother, mother, and then the victim of breast cancer, her daughter, then she herself took the initiative. And what was her initiative? It was just to create awareness, but she didn't stop over here. She also asked the people to invest in that certain area so that if there is any victim of breast disease that might not be dead, so it needs to build hospitals, not only the awareness. Dear guys, dear fellows, it is the month of October, which is considered the awareness month in the whole world towards the breast cancer. Annually, October has been fixed as National Breast Cancer Awareness Month. It is worth mentioning that this campaign was founded in 1985 by the pharmaceutical company AstraZeneca. Since then, it is famous as a pink tuber. Now I talk about what does breast cancer look like. Depending on the type of breast cancer, you may observe lumps on changes in the size and color of your breast. Nipple may also change. How to check one's breast? If someone feels so that she is the victim of breast cancer, then there is a way to check out whether she is affected or not by breast cancer. How to check it? With one hand positions on your hip, use your other hand to run your fingers over both sides. It is the way how to check whether you are the victim of breast cancer or not. Over both sides of your breast to check for lumps or thickness. Don't forget to check underneath your armpit too. This is the way. If there is any type of lumps on your armpit, then it might be a sign or symbol that you are going to have cancer over there. Some women have thicker breasts than others. If so, then observe lumpness. A benign tumor or cyst can also cause lumpness. Here I am going to talk about a certain thing that is worth mentioning, and that I have written with the caption of note. Even having all the symptoms, you need not to be worried. Have a sitting with your doctor promptly and share all that what you have seen in your breast or armpit. It is meant to be, if you see any change that your breast have been dense or thickened, then needs not to have some sort of worry in your mind. Promptly, hastily, hurriedly get an appointment from your doctor and consult him or her immediately. Don't waste the time. What is meant by benign? Is a condition in men or women in which the prostate gland is enlarged and not cancerous. It is meant to be benign. And what is meant by cyst? Cysts feel like soft blisters when they are close to the skin surface, but they can feel like hard lumps. Apparently, they might be looked at soft but feel like hard lumps when they develop deeper beneath the skin. One more thing that take your kind attention. If you find that your nipples are discharging, what your nipples are discharging, here you would see, if you are breastfeeding, you may experience a milky discharge from the nipple. But when this is a certain point, if you are breastfeeding mother, then certainly milk would be over there while the baby is just feeding over there. But when it occurs, that might be an indicator that you have been the victim of breast cancer, and that is the time. But discharge when you are not breastfeeding, it can be an indicator of breast cancer. Discharge may appear. What might be appeared over there from the nipple? Then whitish liquid, clear liquid, and bloody is meant to be reddish liquid. When at that time when you are not going to breastfeed your babies. One more symbol, one more sign, one more symptom is also there that may attract your kind attention, that you have become the victim of breast cancer, and that is the shape of the breast. Breast may naturally swell during the menstrual cycle. Swelling or dimpling at other times may be an indicator of breast cancer. What we need to do then? Consult your doctor if you find the following. First of all, swelling in one breast but not the other. First of all, if your both breasts are in your equal size, then it isn't a matter of worry. But if your one breast is swelled, is swollen, but the second one is not swollen, then there is a problem with you, and it is a clear indicator that you have become the victim of breast cancer. Then the next point is swelling in your breast outside of your menstrual cycle. And then the third one is one breast suddenly appearing larger than the other. Breast swelling that occurs when other symptoms, the same case lies over there, that the swelling is just on your one breast, not on the other, then it is meant to be that there is something to be alarmed. Dear guys, dear fellows, the next picture on your slide, a very clear picture having the breast over there, inverted nipples. If your nipples are in inverted condition, then an inverted nipple itself doesn't mean you have breast cancer. Some women may have a flat nipple that looks inverted, and other can develop an inverted nipple over time. Still, a doctor should investigate and cancer. This is a matter that there are some women who have their certain natural shape of their nipple like that. But if you find that one nipple of your one breast is just getting changed over there, then properly consult to your doctor. What might be there on your breast? What might be there on the skin of your breast or on your nipple? First of all, peeling is over there, scaling is over there, or flaking skin over there. These are the indicators of your breast cancer. A type of breast cancer called Paget disease that affects the nipple can affect your skin. On your breast or nipples, you may notice. On this certain slide, dear fellows, dear guys, I have talked about in detail what is meant by peeling. It is meant to be remove the outer covering or skin. What is meant by scaling? Abnormal shedding or accumulation of an upper layer of skin. Then, what is meant by flaking? It is meant to be skin's way of recovering or healing from some type of damage. And now then one more symbol, one more symptom, one more indicator, dear guys, dear fellows, is over there, and that is skin rash on the breast. Inflammatory breast cancer stands for IBC, is an aggressive but rare type of breast cancer. It affects the skin and lymph vessels of the breast. It starts from a rash as its early symptoms, unlike other. It is meant to be that when on your breast there start just rashes on the skin of your breast, then you need to think that some sort of severe problem is going to occur over there, and at that time you need to consult your doctor. It is a clear to white fluid made of white blood cells. It may be followed by the below mentioned symptoms: swollen breast, warm, reddish breast, and itchy over there. It may appear like clusters of insect bites. These symptoms may fluctuate over time as the cancer grows. It is meant to be that it is the starting symbol of breast cancer, and with the passage of time, all that would be increased. Dear fellows, dear guys, and the next symptom, indicator, and sign is pitting in breast skin. What is meant by pitting? It occurs when excess fluid builds up in the body, causing swelling. When pressures applied to the swollen area, a pit will remain over there. A rash isn't the only visual symptom of IBC. This type of cancer can also change the shape of your breast as well. You may observe dimpling or pitting. The skin on your breast may begin to look like an orange. It is meant to be that orange type skin of the breast might be seen over there, and then peel due to underlying inflammation. It is meant to be that swelling may also be occurred there. What we need to do? How can we avoid this breast cancer? Now the certain slide is over there on your screen. Precautionary measures. Breast cancer can be aggressive and life-threatening, but with early diagnosis and treatment, the survival rate is high. It is meant to be that when someone feels any change on the breast, then promptly consult your doctor. Then even you have become the victim, then the survival rate is very high. And here on the slide, I will talk about that what about the cancer spread? At what stage the survival rate is over there? According to the American Cancer Society trusted sources, the 5-year survival rate for breast cancer, if diagnosed before it spreads from the breast to other parts of the body, is 99%. If the cancer is just at a certain point and it doesn't spread to the distant area, to the other area of your breast, then survival rate is 99%, and certainly that is encouraging. And then the next one is over there. If the cancer spreads to nearby sites, the survival ratio is 86%. If there occurs cancer on one's breast and it just hurts the nearby areas, not the distant area, then the survival rate is 89% over there. And then I talk about if the cancer spreads to the distant area, then the survival rate is really very alarming, and that is just 30%. Routine checkup and treatment can avoid and detect it as its early stage. It is meant to be, once again, and this is the thing that right from the first slide I am talking about, that if there occurs any change in your breast, then you promptly consult your doctor, then there are much more chances of survival. And the next slide, some medical term used: non-invasive disease. What is meant by non-invasive disease? It is meant to be the disease usually don't spread to or damage other organs and tissues. And what is meant by invasive diseases? It is meant to be all these spread in a quick and aggressive manner. And the next term is your ductal. It is meant to be a tube or passage, especially from a gland. Dear guys, dear fellows, once again, the term used in the types of breast cancer, that is lesion. It is meant to be a region, an organ or tissue which has suffered damage through injury or disease, such as a wound, ulcer, abscess, or rumor. And the next term is abscess, a swollen area within body tissue containing an accumulation of pus. There is a cluster of pus. And the next term is mammogram. What is meant by a mammogram? A mammogram is an X-ray picture of the breast. Mammograms can be used to check for breast cancer in women who have no sign or symptoms of the disease. It is meant to be then when there is just a confusion or reception, when one lady feels that there is some sort of change in her breast, but that can't be determined if there is or not, then there is just a machine that is called your mammogram that can diagnose it. This type of mammogram is called a screening mammogram. Screening mammograms usually involve 2 or more X-ray pictures or images of each breast. It is meant to be that each breast, that particular certain machine take 1 or 2 or 3 images just to diagnose, just to detect, just to determine whether the woman is the victim of breast cancer or not. Dear guys, dear fellows, it is the picture of mammogram, and a woman is also standing over there. That how a woman can be screened. No, a special slide over there. What are the causes of breast cancer? Age and breast cancer risk. First of all, whether the growing age affects a man or a woman or not, then most breast cancer meant to be 80% occur in women over the age of 50. It is meant to be that when a woman touch the age of 50 or over 50, then there might be the chances that she might be the victim of breast cancer. And the older you are, the higher your risk. It is meant to be with the growing age, the risk of becoming a cancerous woman is already over there. Most men who get breast cancer are over 60. It is meant to be if a woman might be the victim of a cancer, then her age is over 50. But when a man, then over 60. Now, there is a slide, and it is a pertinent slide that there are some things we can't control, we can't restrict at our own nerves, and that is getting older. If Allah Almighty has given someone good age, meant to be growing older and older, then certainly one can't stop it, one can't restrict it. Some other things that you can't do anything about can affect your risk of breast cancer, and that is getting older. And no, when a woman might be the victim of breast cancer, when you started having periods. It is meant to be women who started their periods at an early age before 12. It is meant to be medically when a girl reaches the age of 12, then the periods starts over there. But when a girl before 12 start all that, then there are much more chances to be the victim of cancer. Have a slightly increased risk of breast cancer. The earlier you begin your periods, the higher your risk. It is meant to be before a certain age. If there starts the period in the women, then the risk of becoming cancerous are much more. Once again, the caption over there, dear guys, dear fellows, is causes of breast cancer. Lifestyle and breast cancer risk. Making small changes and living well now, you can lower your chances of getting breast cancer. A plain, simple life can avoid anyone to be cancerous. Precautionary measures. What should we avoid to become the victim of cancer? And first of all, there is wine, alcohol. Regularly drinking alcohol is associated with a higher risk of developing breast cancer. If you keep on drinking alcohol on regular basis, then the chances are much more. And the next point is being overweight. Certainly, what medical science speaks over there, that your weight is according to your age. And if your age is minimum but your weight is more than that, then the chances of breast cancer or the cancer are much more. Your risk of developing breast cancer increases if you are overweight or obese after the menopause. How to avoid breast cancer? It is also meant to be precautionary measures. Keep active. You can reduce your risk of breast cancer by being physically active for around 20 minutes a day. It is meant to be exercise, walking, jogging. If you are less than 30, you might keep on running over there. If you are getting older and older, then jogging over there, then walking over there, and might be striding over there. If you are not becoming older over there. And the next, what we should not, that is smoking. We shouldn't have all that. There is growing evidence that smoking slightly increases the risk of breast cancer. The younger a woman is when she begins smoking, the higher the risk. The increased risk remains for at least 20 years after stopping smoking. This is alarming. When a man or a woman, after being a smoker, even he or she leaves all that smoking, then the consequences, then being the victim of cancer might be even after 20 years of leaving smoking. Dear guys, dear fellows, and the next slide is the cancer risk you can't control. When you go through the menopause, certainly it associates with the women. If you go through a later menopause, the average age is 52. It is meant to be after that certain age of 52, all that stops. Your chances of getting breast cancer is slightly increased. Dense breast tissues. It is meant to be that the tissues of the breast, if are thicker, then breast density is the amount of breast tissue compared to fat tissue in your breast. If you have a high amount of breast tissue compared to fat, you have a high breast density. It is meant to be breast density varies naturally between women, which can only be measured on mammogram. The breast density, it can't just be seen. It can't be diagnosed without screening by mammogram. What are the causes of breast cancer, dear guys, dear fellows? Pregnancy and breastfeeding. Having children has a complex effect on breast cancer risk. Overall, in the long term, pregnancy reduces the risk of breast cancer. Breastfeeding your children slightly reduces your risk of breast cancer. It is meant to be if you are keep on feeding your babies. And what we being the Muslim believe that if a mother keeps on feeding her babies for 2 years, then on the other hand, the chances of breast cancer are minimized even to nil, but also she might not be pregnant as well. And then the pill and HRT. HRT stand for hormone replacement therapy. It is meant to be when a woman is just going to restrict in the issuance of babies or just to stop to become pregnant, then certainly a woman uses contraceptive, and that are oral pills. Taking the contraceptive pill slightly increases your risk of breast cancer. Within a few years of stopping, however, this risk disappears. Yani if any woman starts taking contraceptive but then she stops taking it, then the chances of becoming the victim of cancer become very low, even to nil. Once again, what are the causes of breast cancer? Hormone replacement therapy, it is the acronym of HRT. HRT increases your risk of breast cancer while you are taking it and for a few years after stopping. And then what the doctors say about it? A family history of breast cancer. It might be a rumor, it might be a myth that if in a family there is someone who has been the victim of any disease, then it is said that in that chain of that family, someone else would also be affected with a certain disease. Having someone in your family with breast cancer doesn't automatically mean your own risk is increased. So it is meant to be, one needs not to think that if one's father, grandfather, mother, grandmother has been affected by any disease and the same disease might be affected him, such must not be thought. For most people, having a relative with breast cancer does not increase their risk. It is meant to be if one's relative are affected by breast cancer, so it might not be thought that he or she would also be the victim of all that. However, it has been noticed that some people have been the victim of breast cancer. It is also over there, chances are over there, but it isn't a fact. Once again, causes of breast cancer, myths, assumption. We just take an example, and what is the example? Some people worry about using deodorants. What is meant by deodorants? Types of products can help with the body odor, ODO or odor. It is meant to be bad smell. Deodorants cover up the smell of body odor, usually with fragrances. We use some sort of sprays just to keep or just to free away that certain odor, or wearing an underwire bra, and something that if any lady keeps on wearing bra, it might affect her. But these things do not increase the risk of breast cancer. Dear guys, dear fellows, it is a picture of cancer breast with symptoms and names. Inflammatory breast cancer. It is a picture that the breasts are swollen over there, and it is a clear indicator of a cancerous breast. It might be avoided. If for the first time any lady notices that her one breast or both of the breasts have been swollen, then right at that time, without delaying or wasting the time, she must consult the doctor, because at early stage, if it is diagnosed, then the chances of recovery or survival are much more. Dear guys, dear fellows, this is one more picture of a breast that is not only swollen but redness is also over there. It is also a cancerous breast. One more picture of cancerous breast you might see, like the orange shape is over there and a symbol of armpit over there also, that it is just spreading to the distant areas. What are the symptoms? What are the signs of breast cancer? Dear guys, dear fellows, lumps, what it is meant to be: a compact mass of a substance, especially one without a definite or regular shape. Then, what is the second symptom? What is the second sign? What is the second indicator? And that is nipple discharging. This point I have already talked about, that when a woman, a mother, discharging of any liquid that might be clear, that might be whitish, that might be bloody, meant to be reddish, when at that time when she is not going to feed her baby. Then dimpling over there, breast pain, when any lady, any girl starts feeling pain in her breast, then promptly consult your doctor, and it is a clear indicator to be the victim of breast cancer. What is the next symbol? And that is nipple retraction. Change the nipple, the shape of the nipple. Redness on nipple. In the previous slide, I have shown you the picture of that breast, that there is extreme redness on the breast. Changes to skin texture. Even the textures of the breast skin is changed. And then lymph node changes. Nodes meant to be the nipples of the breast also changes. Swelling on nipples, and not only on the breast, it might be on your nipple. And if there is swelling on your nipple, then make it sure that you are going to become the victim of breast cancer. Dear guys, dear fellows, it is a picture of, in the last slide, we have seen breast cancer lumps discharging is as well. Dear guys, dear fellows, if we find our relative, our friend, our fellow become the victim of cancer, then how can we help or assist him or her emotionally? Keep in touch with your cancerous fellow by sending a bouquet to assure your nice feelings or commitment. Such activity may encourage and will give strength to the victim. It is meant to be that when you know that your fellow, your friend, your relative has become the victim of cancer, then don't let him or her away. Just be in touch with her and send him or her a gift. Certainly, it will encourage him or her. And then help your cancerous fellow how? Offer to drive him or her to medical treatment, or what facility you may provide to your cancerous fellow. It is meant to be that when there is an appointment of your cancerous fellow with the doctor, then just go to his or her home and pick him or her just to be with him or her to the doctor. Certainly, the time you would enjoy with the cancerous fellow, give him or her a strength. Just make a phone call to ask, how are you? What about you? What are you doing? Just not only be sympathetic, but be with him or her. Keep on calling, keep on in touch with him or her, and that is a cancerous fellow. How to assist one's cancerous fellow? We may send or give fruits to him or her. What more we can do? How can we help or assist our cancerous fellow? Be with your fellow so that he may not feel lonely, as it will make him happy and strong. Just go to your cancerous fellow home, pick him or her, and just go to a park. Certainly, it will give strength to him or her. How to assist your cancerous chum? Be with him at a cafe to enjoy a cup of coffee, as this moment of happiness will give him strength. Certainly, if you pick your cancerous fellow from his or her home and you just remain with him or her for a few hours, certainly he would forget his disease, even a fatal disease. One more way just to relax or give strength emotionally to your cancerous fellow, and that is accompany the cancerous fellow in watching a movie just to show your commitment that you are with him in the time of trial, and it will encourage the victim certainly. Dear guys, dear fellows, it is a very clear picture. It relates to medical men that what type of cancers might be there and what are the veins from where it spread to nearby and are distant places or sites. Types of breast cancer: ductal carcinoma in situ or intraductal carcinoma. It is a precancerous or non-invasive cancerous lesion of the breast. It is considered as stage 0. It seldom produces symptoms or a breast lump one can feel, typically being detected through screening. And this screening is made at mammogram, that is called mammography. In the last slide, there was the word in situ. What does it mean? It means to examine the phenomena exactly in place where it occurs. And then another type of breast cancer, that is Paget's disease. It is a type of cancer that outwardly may have the appearance of eczema, with skin changes involving the nipple of the breast. It purely relates to your nipple. There occur changes. The condition is an uncommon disease accounting for 1 to 4.3 of all breast cancer, and it was first described by Sir James Paget in 1874. Eczema or atopic dermatitis is an inflammatory skin condition that affects an estimated 30% of the US population, mostly children and adolescents. It is a chronic disease characterized by dry, itchy skin that can weep clear fluid when scratched. Now, then I talk about the countries with the lowest breast cancer ratio. First of all, Sudan, South Sudan, Tavachai, Timor-Leste, Tajikistan, Republic of Congo, Bhutan, Nepal, the Republic of Gambia or Niger. And now the slide on your screen is countries with highest breast cancer ratio, and all these are developed countries. Belgium stands first in that crucial area of fatal disease. And the second one is Netherlands, Luxembourg, France, New Caledonia, Denmark, Australia, Finland, and then USA. These are the countries where the ratio of cancerous victims are much more high. And now the slides start. What should we eat? What are the foods that can keep us intact just to become the victim of cancer? And first of all, the slide on your screen is an apple. It is said that eating of one apple daily keeps you away from the doctor. Dear guys, dear fellows, the next fruit is berries, full of nutrients. And the next one is pomegranate. The next one is your that avoid cancer is lemon. And the next fruit that is called your banana. But it needs to be thought that the maximum eating of banana might make you the victim of sugar. Just consult your doctor that how many bananas you can take in a day. The next fruit is your oranges. The next one, dear guys, dear fellows, is strawberries. Next one, the fruit that avoids cancer is your cherries. And now I talk about the vegetables. What vegetables are beneficial that avoid us to become the victim of cancer? And all that are tomatoes, carrots, peas, pumpkin, and turnips. It contains vitamins and fiber. Cruciferous. What is meant by cruciferous? Meant to be plants including cabbage, turnip, and broccoli. Broccoli, cauliflower, and cabbage, it reduces cancer risk. And the next vegetable is bitter gourd for lowering blood sugar level as well. And then the green leafy vegetables for calcium and iron. Dear guys, these are the picture of some vegetables. Broccoli on your right hand, the top, and then your cauliflower, then your cabbage, and on your left on the bottom is your bitter gourd. Dear guys, dear fellows, now I talk about all that who just lost their life just because of cancer. And first of all, there is the personality that died of cancer, Aretha Franklin, to be remembered as the Queen of Soul. Aretha Franklin died of pancreatic cancer. She passed away on 16th of August 2018 at the age of 76. The next personality entity was David Bowie. David Bowie, the British rock star who will forever be remembered as Ziggy Stardust, lost his life to liver cancer. He died of January 10th, 2016 at the age of 69. The next entity, the personality who died of cancer, was Greg Allman. Greg Allman of the Allman Brothers Band died from liver cancer on May 27, 2017. He was 69 years old. He belonged to America, USA. Dear guys, dear fellows, the next personality, the next entity is Donna Summer. Grammy-winning recording artist Donna Summer died of lung cancer on May 17, 2012. She was 72 years old. She belonged to America too. And the next lady, the next personality, the next entity who died of cancer was Linda McCartney. Wings musician Linda McCartney, wife of Paul McCartney, she died from breast cancer on April 17, 1998. She was just 56 years old. How painful it is. It is pitiable. She was an American. And the next personality, the next entity who lost his life was George Harrison. Former Beatle and solo recording artist George Harrison died of lung cancer on November 29, 2001. He was 58 years old. It's also pitiable. He was a UK citizen, lived at Liverpool. And the next personality entity who died of cancer was Bob Marley. Reggae superstar Bob Marley died of cancer on 11th of May 1981 at Miami in USA. At that time, he was going back to his country due to bad health. He was died of the age of 36. How painful. He was just going back to his own native town, Jamaica, and while he was in the plane had to land over there, and the city was Miami. Bob Marley was rushed to the Miami hospital, but he couldn't survive over there and died of cancer. And next, Irfan Khan. Indian actor Irfan Khan, known for roles in Slumdog, Millionaire, and Life of Pi, passed away of cancer on April 29, 2020. He was 53 years old. And the next entity who died of cancer was Valerie Harper. Actress Valerie Harper of The Mary Tyler Moore Show and Rhoda on August 30, 2018. She was initially diagnosed with lung cancer. She was 80 years old. She was also an American. And the next was John Hurt. British actor Sir John Hurt died of cancer on January 25, 2017 at the age of 77. His 50-plus year career included roles in An Englishman in New York, Tinker Tailor Soldier Spy, The Elephant Man, and many other movies and television shows. The next personality, the next entity who died of cancer was Patrick Swayze. Dirty Dancing and Ghost actor Patrick Swayze died of cancer on September 14, 2009. He was just 57 years old. Dear guys, dear fellows, the next entity, the next personality who died of cancer was Farah Fawcett. Charlie's Angels actress and model Farah Fawcett died of anal cancer on June 25th, 2009. She was 62 years of age. And the next one who died of cancer was Merv Griffin. Actor, talk show host, and game show creator Merv Griffin lost his life to prostate cancer on August 12, 2007. He was 82 years old. Dear guys, dear fellows, today it was all about Pinktober, and Pinktober is associated with a very fatal disease of cancer, especially breast cancer. I tried my level best to talk about, to share all that I thought was necessary to create awareness. From my first slide to the last, I think so that I haven't leave any area that was needed and I just leave it. I don't think so. It was a video lecture just to create awareness and all that precautionary measures and what elements are there. If we take all that then we might be the victim of cancer. So what we should do, if we see any change in our breast and under the armpit, then we promptly rush or consult to the doctor. We need not waste the time. So dear guys, dear fellows, I just ask your permission, just allow me to wind up this video lecture till the next one. So it's Ali Khan Wajid and my channel name is Unique Thoughts. Hope you would have all that what was necessary regarding this certain caption of Pinktober. Thanks you. Have a nice day. Have a sound sleep. Allah Hafiz and take care.